How's it going, guys? Past level question, pathology, step 1, internal family medicine, 2CK. 41-year-old man, 3-month history, fatigue, generalized weakness, bilateral hand pain. Physical exam shows hyperpigmentation, skin of the forearms, and hepatomegaly. X-ray of the hand shows chondrocalcinosis. Laboratory studies show fasting glucose 112, which is impaired. Should be 72 to 99. Impaired fasting glucose, prediabetes, 100 to 125. 2 fasting glucose is 126 or greater. Diabetes mellitus. Question wants to know which of the following most likely explanation for the patient's findings. Choice A, adrenal cortical hypersecretion. Wrong fucking answer. Zonal glomerulus fasciculata reticularis, secreting aldosterone, cortisol, DHS, androstenedione dione, respectively. Nothing in this vignette points toward hypersecretion of any of those. High aldosterone, high sodium, low potassium, metabolic alkalosis, high blood pressure, cortisol, obviously Cushing syndrome. I've never seen, maybe one question only, I've seen them give high DHEAS to reflect hypersecretion from the zona reticularis layer. Wrong fucking answer. Choice B, adrenal cortical hyposecretion. Wrong fucking answer. Could refer to Addison disease, idiopathic autoimmune, decreased production of aldosterone, cortisol. Would give you hyperpigmentation, yes. And it would give you fatigue, yes. But the rest of the vignette doesn't corroborate. I'll talk about the other findings as we move through. Could also refer to Waterhouse-Friderichsen syndrome. Wrong fucking answer. Choice C, beta islet cell glutamic acid decarboxylase 65, GAD65 autoantibodies. Wrong fucking answer. So this is type 1 diabetes. Okay, so obviously there's impaired fasting glucose here, but the vignette is classically going to be a child or teenager who had a recent viral infection and now has a metabolic acidosis, your DKA. Wrong fucking answer. Choice D, excess cation absorption. Correct answer. Diagnosis, hereditary hemochromatosis. Chromosome 6 HFE gene, autosomal recessive, leads to an inability of the duodenum to shut off iron absorption. So the body has poor regulation of iron excretion. Women have protracted or delayed presentation of hemochromatosis because their menses are protective. It's the equivalent of having serial phlebotomy, which tangentially is the treatment for hereditary hemochromatosis. Don't choose chelation agents, such as deferoxamine, which is the treatment for secondary hemochromatosis, which is transfusional siderosis, e.g. from chronic blood transfusions. You're going to choose serial phlebotomy. The point is, excess iron absorption in the duodenum is the mechanism USMLE wants you to know for hereditary hemochromatosis. Hyperpigmentation, this is bronze diabetes colloquially. This is hemosiderin deposition in the skin. Okay, it's an important differential for hyperpigmentation on USMLE. You can get iron deposition in the tail of the pancreas, which can cause impaired fasting glucose or overt diabetes. Chondrocalcinosis, hemochromatosis, important cause of pseudogout. Holy shit. Okay, so pseudogout, they can tell you chondrocalcinosis, just a finding you'd see on x-ray. They can also give pseudogout in one of two presentations. It can be a monoarthritis of a large joint, such as the knee, or it can be an OA, osteoarthritis-like presentation of the hands with DIP involvement in a patient who has hereditary hemochromatosis, primary hyperparathyroidism, or hypothyroidism. Let's just hop to the finalized choice. Multiple endocrine neoplasia. Wrong fucking answer. Okay, so, I mean, if you're not sure of the diagnosis here, you might get thrown off, but obviously, MEN1, that's going to be pituitary, parathyroid, pancreas. MEN2A is going to, and MEN2B will both be pheochromocytoma, medullary thyroid carcinoma, as 2A is going to be parathyroid hyperplasia or adenoma, but 2B is going to be marfanoid body habitus, mucosal neuromas. Choice E, wrong fucking answer. You know the deal. I'm just going to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.